Hi everyone, this is Megan Von Sell, your cancer expert, and I'm the owner and CEO of Cancer Peace University, where it is our goal to set you free from the fear of cancer. In this video, I'm going to be talking about essential oils and cancer. And I'm going to focus on one specific essential oil that has been found in the research to support during a cancer diagnosis. First of all, essential oils will impact the body in many different ways. In general, essential oils will enter the bloodstream through the lungs as you inhale the scent of the essential oil. You can use a diffuser. You can also put the essential oil on your hands and smell the essential oil, and it will impact the biochemistry of the nervous system. Many essential oils can act as an antibacterial, antiviral, or antifungal agent. Also, the essential oils have been found to influence the limbic system, which is in your brain and controls memories and emotions. And essential oils also have been studied for how it influences the central nervous system and the autonomic nervous system, both the sympathetic and parasympathetic branches of the nervous system. A study done in Japan in 2002 found that certain essential oils would stimulate the sympathetic nervous system, where other oils would calm the sympathetic nervous system down. And this is important with the cancer diagnosis because part of the autonomic nervous system's role is to be able to switch between parasympathetic and sympathetic activity as to respond to the metabolic needs. And when there's stress and daily stressors, the body will respond with the sympathetic nervous system becoming active, with the parasympathetic nervous system becoming more dormant. And this is called reciprocal inhibition, where one nervous system will become more active, the other become more dormant. But Pottinger in the 1920s discovered that nervous system dominance was a component to diseases. And specifically, for longer periods of time, part of the autonomic nervous system would become dominant and the other part of the nervous system would not be able to switch back and forth with its normal mechanism when disease processes started within the body and even with cancer. And so essential oils can help to calm the sympathetic nervous system if it is dominant, or to stimulate the sympathetic nervous system if the parasympathetic nervous system is too dominant and lending itself towards dysfunction in the body in the disease process of cancer. And one essential oil that I want you to be aware of that is supportive during a cancer diagnosis is known as Copaiba. Copaiba has amazing medicinal qualities and have been used for centuries in South America. Copaiba is tapped from the trees in South America, Copaiferas officinales, and it's tapped similar to how maple syrup and rubber are tapped from trees, and then it is steam distilled and created into Copaiba essential oils. And in Brazil, Copaiba has been used for inflammation, specifically for sore throats, for tonsillitis, bronchitis, and in the Amazon, healers known as curanderos have used Copaiba for a variety of inflammation disorders, including urinary tract infections, bladder infections, wound healing, as well as pain relief. And it's important to understand the studies behind Copaiba and cancer. Copaiba contains an important phytochemical known as beta-caryophyllene. Beta-caryophyllene has been studied for its ability to reduce inflammation. In a study released in September of 2015, beta-caryophyllene was found to inhibit the growth of solid tumors and to block the metastasis in the lymph nodes for mice with melanoma. And Copaiba has been studied for its anti-proliferative activity and its ability to stop malignant cells from invading surrounding tissue. Another study released in December of 2015 researchers were looking at Copaiba's ability to kill MCF7 breast cancer cells and actually found that Copaiba was able to kill MCF7 breast cancer cells better than a common chemotherapy drug. And the last study that's important with cancer is a study released in the Brazilian Health Journal looking at oral health with cavities and tooth decay, finding that Copaiba is actually able to stop the reproduction of a specific bacteria, Streptococcus mutans. And this bacteria is responsible for tooth decay and cavities that can eventually lead to root canals. And Dr. Robert Jones performed a 5-year study and found that 93% of women with breast cancer also had 1 or more root canals. And root canals can be a contributing factor in a cancer diagnosis, and specifically with breast cancer, because when the dead tooth is left within the mouth, there's anaerobic bacteria at the root of the canal that will start dripping into the lymphatic system and the circulatory system, acting as a chronic bacterial infection that the immune system has to deal with, leading to the depletion of the immune system and eventually a state of anergy or non-reactivity of the immune system that is common with cancer. So Copaiba is a great strategy to help support or prevent cancer. Copaiba can be used by diffusing it in a diffuser. You can rub it in your palm of your hands and you can smell the aroma. You can use it also on your skin, rub in your skin in the affected area. You can also apply Copaiba to the soles of your feet and add it to bath water. And Copaiba can be used with internal use, making sure you're buying from a reputable company and a good source of Copaiba. So I hope this helps you understand essential oils and cancer, and specifically Copaiba and cancer. If you are a holistic practitioner and you want to learn more about becoming a Cancer Peace University instructor, send me a personal message or email me at cancerpeaceuniversity@gmail.com. I am now currently launching instructors, and we are starting to educate the average American and the average person on what is cancer from the holistic angle. The next mini course will start in April, and it's a 6-week mini course on what is cancer with Cancer Peace University, and my next full course will be starting in August 2019. And if you reach out to me to find out more about becoming an instructor, I will send you a copy of my book, What is Cancer, and I hope to be in touch with you soon. Have a great day.